You know, an ER team is one of the most incredible dynamic units in a hospital. But as a future ER nurse, have you ever stopped to think about how that team is actually put together? Well, in this explainer, we're going to pull back the curtain on the entire process, from a manager's secret playbook all the way to your very first schedule. Let's dive in.
Right now, you're probably buried in clinicals and coursework, right? But there's this whole other world, this complex machine, working behind the scenes to build the very team you're dreaming of joining. So today, we're going to walk through that entire journey, from being just a candidate to becoming a true colleague.
So here's our game plan. We'll start with the secret blueprint managers use before a job even gets posted. Then, we'll talk about how to get your application noticed, how to absolutely ace the interview, what happens when you make that leap from candidate to colleague, and finally, we'll decode those schedules that are going to shape your work life.
First up, the staffing blueprint. You might think the whole hiring thing starts when you see a job ad online. But the truth is, the planning for your job probably started months, maybe even years ago.
A smart ER manager isn't just reacting to empty slots. They're playing chess. They are actively tracking enrollment at local nursing schools. Yeah, they are literally looking at your class. They study resignation patterns to see when people tend to leave, and they predict patient surges like flu season. Basically, they're planning to hire someone just like you long before you even start your job search.
Okay, so once that plan turns into a real job opening, the hiring process kicks into high gear. This is your first real challenge. How do you get your application out of that huge pile and become a person they need to talk to?
It all starts with recruiting. You can think of this as the hospital sending up a flare, casting a wide net to find potential team members like you. They'll put up ads in journals, on their websites, all to make sure you know the opportunity is even out there.
After you hit apply, the selection process begins. They're going to verify all your qualifications and check your background, of course. But here's a key piece of the puzzle, the medical exam. It is not just a formality. They need to make sure you can physically handle the demanding pace of the ER, and it sets a health baseline for you from day one.
So you made it through the first cut. Awesome. Now comes the most important part, the interview. Let's really break down what's going on in that room so you can walk in there feeling totally prepared and confident.
You know, most nursing interviews follow a pretty predictable script. It'll start with introductions, then they'll confirm the role you're there for, they'll look over your application with you, and then they'll hit you with the qualification questions. At the end, they'll tell you what's next, like that physical exam we talked about, and then wrap it up. When you know the flow, there are no surprises. Okay, think of this as the interviewer's secret toolkit. They are trained to use very specific techniques to get the real story. They'll use open-ended questions to get you talking. They'll avoid giving you any little hints about what the right answer is. They are trying to get a sense of the real you, and knowing their strategy gives you a massive leg up. And here is their number one power move, the pause. It's so simple. An interviewer will often just stay quiet for a few seconds after you finish an answer. Now, it can feel a little awkward, but it's a deliberate tactic to see if you'll add more detail. Don't feel like you have to rush to fill that silence. Knowing they're doing this on purpose is a total game changer.
Yes, you got the job. But believe it or not, the process isn't over. Now comes this really critical phase, the transition from being the new hire to being a real integrated member of that ER team.
So, once you're officially hired, the next step is placement. And this is a huge deal. It's not just about filling a spot. Getting you in the right role leads to success and satisfaction. The wrong placement? Well, that leads straight to frustration and burnout. The hospital's goal is to find that perfect fit where you are going to thrive. Your first week on the job will probably feel like a whirlwind orientation. It's basically a crash course in how that specific hospital works. You'll get tours of different departments, go over all the rules, learn the daily routines, and, most importantly, you'll start meeting your new teammates. It's all designed to get you up and running as smoothly as possible.
All right, we've made it to the final piece of this whole puzzle. And honestly, it's the one that's going to define your day-to-day life as a nurse more than anything else, scheduling. How your shifts get decided has a massive impact on pretty much everything.
So, broadly speaking, there are two main systems. With decentralized staffing, your direct manager makes the schedule for your unit. The big pro here is that you usually get more flexibility and a say in things, which tends to make nurses happier. Then there's centralized staffing, where one main office does scheduling for everybody. This is usually seen as more fair and consistent, but you definitely lose that personal flexibility. Now, within those systems, your actual schedule can look a few different ways. You might have a permanent shift, where you're always on nights, for instance,
or a block schedule that repeats so it's super predictable. There's also variable staffing, which changes based on patient needs, and then of course there's the one you'll probably run into the most, rotating shifts. And we've got to be real for a minute about those rotating shifts. While they're incredibly common, the research is pretty clear. Constantly flipping your sleep schedule can create a lot of stress. It can impact your health and even the quality of your work. It's just a really important thing to be aware of as you step into your career.
So, we've gone through the whole system, from the manager's long-term strategy all the way down to your weekly schedule. It all leads to this final, really important question. Knowing everything you know now, what kind of system would you want to work in? And maybe even more important, as you grow into a leader one day, what kind of system would you build for the nurses who come after you?